Well, here's the second part of this was this Amy's question, I believe? Oh yeah, Amy's question. The second part is, can you use chiropractic as a general physician? So I guess she wants to know, instead of having a general physician, can your general physician basically be a chiropractor?
Well, here's the thing. You know, people refer to us as back doctors. We're really nervous system doctors or spinal column doctors. It just happens to be that your nervous system is located in your back. And that's how we deliver our adjustments. If the nervous system was located in your left leg, I guess we'd be called left leg doctors, right? So we
right?
We don't necessarily work on the back. We use it as a vehicle. That's where the circuit breaker of your home lies, is in your spine. So when you're having a problem down your leg or a problem down your arm, we trace it back to the circuit box and we hit the switch, put the vertebra back in place, turn power onto the nervous system. So we realize that that nerve just doesn't run down the leg. That nerve also controls your reproductive system, your digestive system. So we've had patients pull us aside, some elderly men, say, "Hey doc, things downstairs are working a little better." And I'm like, "Oh, great. What are you talking about?" So, you know, and then we're talking about, you know, Bob Dole's problem, right? So we're talking about erectile dysfunction. And I explained, let's go back to look at your film. You had an L4, L5 impingement of the nerve that runs down the leg, but it also goes to your reproductive organs. So if I put a clothespin on the nerve that went to your reproductive organ, over time, how do you think your reproductive organ would work with 40% less nerve impulse? It would work 40% less, at least. So to summarize, basically, you look to you know, Dorland's medical dictionary. They talk about the central nervous system, the CNS, which is brain and spinal cord. And that's what we analyze and detect. And Dorland says that the central nervous system controls and coordinates every living cell, muscle, tissue, and organ system in the body and relates it and adapts it to its environment. So everything from blinking your eye to wiggling your finger to making love with with the reproductive organs functioning properly is all under direct control of the nervous system. So chiropractor's job is to make sure the nervous system's functioning properly, and then the rest of the body will function properly.
That makes total sense. And you know, that's really one of the reasons why I've chosen chiropractic for the last 18 years. As you know, that's my primary care doctor is my chiropractor. Like, I've been to the medical doctor like twice in 18 years, and I really contributed just to the fact that I've been making sure my nervous system has been working well. And you know, my chiropractor's been doing an excellent job of it. I'm here in Texas. If I were in Edison, New Jersey, I'd be coming to you guys, no doubt. But yeah, that definitely makes sense.
You know, there's something called crisis care also, Chris. Mm-hmm. You know, if I walk out of my office and we're right next to the fire department, and I got hit by a fire truck screaming down the block, I'm not going to be carried back in and have Dr. Jeff adjust. Well, maybe get adjusted and then go to the hospital. You know, and we always say chiropractic first, drugs second, and surgery last. There's a place for crisis care. You know, I haven't had a prescription drug in my body in almost 30 years. But I get hit by that fire truck, you can inject morphine in my eyeball. You know, just give it to me. But so there is crisis care that's often needed. So
right.
You know, let me use that as a disclaimer. It's perfect.